I'm pulling my hair out with all these students coming in. I don't know why they're coming now. Maybe it's because it's the end of the semester. Or maybe students have only just now begun to understand how they can benefit from help. We've just had an onslaught. More than we can really handle.
What are the numbers?
As you know, just 3 of us are handling this community college contract, and we've had 10 to 12 new students a week. They're coming in for stress-related issues and substance use. Alcohol problems are on the rise, and we're also seeing a lot more students smoking marijuana. Some of these kids are really under a huge amount of stress, but then again, I don't think others really need intensive services.
Way to handle the increase.
Well, I've done a little research, and I found some online resources that look pretty good. One is a comprehensive package for stress management, alcohol and drug use, nutrition, sexual health, and a variety of other topics. In this particular program, the students can go to the program website on their own, using a desktop computer, a laptop, a tablet, or even a smartphone. The site does some neat stuff based on education and CBT. There are a lot of cool tools that mirror things we already do clinically with students regarding prevention and relaxation. I wanted to talk with you about maybe integrating the package into our system of care.
Do you know of any other college that's using this kind of program?
Well, I don't have much spare time, you know? But I did some homework, and it seems like a number of colleges use this particular program. Some of them resemble our college, with an urban location, lots of commuting students, and limited treatment services for substance use and mental disorders. Some require all freshmen to do an orientation to the website, but others require that all students participate in just the alcohol and drug use part of the program. It looks like there are some data about the results and some evidence to support its use. I think it's pretty credible. What I like is that it's all contained in one package, just one stop, and you'd have a range of resources to meet the variety of significant needs here in the college community.
Can we get references from some of these other schools? I'd like to talk to them first. Also, I'm a little concerned about the all-inclusive package. It might be the case that not all elements of the package are high quality. We'll need to check into that.
That's a good idea. I'll contact the colleges and talk to some of our colleagues there. I'll ask them about their experience with the program.
I'd like to know whether there are other programs or other kinds of options. We could find out what the advantages or disadvantages are with them. I'd also be interested in how they measure success, and if we would measure it in the same way.
Not everything that sounds good is good. Behavioral health service providers and program administrators must always ask questions and critically examine the evidence to determine whether a particular technology works or does what it purports to do. The National Registry of Evidence-Based Programs and Practices, NREPP, may have helped John and Nancy find some clarity as they struggled with these concerns. NREPP is supported by SAMHSA and reviews programs and services that voluntarily seek such review. The NREPP website offers info and assistance related to identifying and assessing the evidence-based qualifications of any program. John and Nancy could also decide to collect information about the results of whatever program they decide to use. Doing so could help them determine how well the program is working with their population.
There are similar tools online that help kids handle stress better and improve their time management abilities, and some have risk reduction programs attached to their substance use packages.
I think we'd be better off using what has been tested on other campuses with a similar group of people who have similar problems. Of course, there may also be some new, relatively untested programs that look good too.
That makes sense.
On the other hand, I know there is a lot of stuff out there already, so many of it pretty well documented. I wonder if we can make up our own package, from scratch, to reduce costs.
Some characteristics of digital comprehensive assessment tools are that the use of digital tools saves time and cost. It can also free up clinicians' schedules so that they can focus on other issues. Many comprehensive digital assessment tools are evidence-based, provide reliable and concise information, and can address a broad range of issues relevant to specific populations, such as college students. Reporting features are available in some such tools. These features can assist clinicians in treatment planning. Digital assessment tools can reach people in need who are reluctant to access services through traditional delivery methods. Such tools can provide ongoing client assessment. Some such tools are available to the consumer 24 hours a day, 7 days a week. Using digital assessment tools can provide continuity of care with automated message reminders about appointments, medication reminders, or preventive health facts. You can find some examples of outreach, Screening and early intervention programs for college students. First, My Student Body. This website contains a suite of online behavioral health interventions targeting risk issues central to young adults, including alcohol and drug use, tobacco use, HIV and STD prevention and sexual health promotion, stress, and nutrition. The interventions are grounded in motivational enhancement and evidence-based behavior change principles. Then eCheckup to go. This website provides online personal alcohol risk assessment and motivational feedback. In addition, psychoeducational and interactive tools build awareness of the consequences of alcohol use and support social norms. The next is Alcohol EDU. This online alcohol education program aims to reduce alcohol use and associated risks. It incorporates video, audio, and interactive tools to promote awareness about risky alcohol use and skills to avoid risky drinking. Lastly, Drinkers Checkup. This website provides online alcohol risk assessments for individuals. There are 3 sections to the site: looking at your drinking, getting feedback, and deciding whether or not to change. The instrument is brief and non-judgmental about alcohol use. Well, that's a choice we'll have to make. We could just find a couple of packages that address stress management and alcohol and drug use and not get into other issues, because there are packages that deal with these 2 issues specifically. The other option is to go in a more comprehensive direction, but the choices in that direction are more limited, at least right now. The other thing I think is important is deciding what level of stress, impairment, or pathology we're going to address. Do we want to take a broad approach, something to introduce all students to various problems and options? Do we want to screen for certain problems like stress, alcohol, and drugs? Do we want to offer options for people with significant situational stress? What about supplemental interventions for students with pretty serious alcohol and drug or mental health problems? Let's clarify our goals first and how we would measure our desired outcomes. That'll bring clarity in choosing a program. Another issue is the evidence base for these programs. At least one is listed in REP, and some of the smaller, less comprehensive packages probably have some research behind them, too. We also want to look at the evidence in the evidence-based program. Is it one small trial or more substantial research that supports the program? There's a lot to think about here.
Yeah, there is. Did you find any data to suggest that any of these programs would either cost us more or save us money in the long run?
Well, some of the programs definitely have costs involved. Some charge on a per-use basis, others seem to have a yearly subscription, and I would imagine there are some programs you can just buy outright. As for savings, if we can serve more students with the resources we have, then that cuts costs per unit of service. That would help us meet our goals more efficiently. Maybe we can do a pilot program for a year or so with some specific funding to try to understand the program's effectiveness, costs, and benefits.
Don't you think this will increase the client flow, rather than
I'm hoping it'll
reducing it?
reduce our workload and increase the client flow at the same time. We'll be screening more effectively by having students do a self-assessment. Students, before they decide to come in to see us in person, can take a computer-assisted self-assessment, learn a little about stress management, and then self-screen for substance use disorders and mental illness. Kids who are really in crisis and need immediate services will be able to bypass that and come right to us. It also lets us free up treatment time by providing online psychoeducational information at different stages in a client's change process. It would also be more efficient in terms of our staff workload. If young people at lower risk receive education and a brief intervention online, we can spend more of our time on those kids who are struggling with more intransigent issues. The risk profile that the program creates after someone takes the personal risk assessment can be a really helpful reference if the individual does come to see us. It's a good place to start. It shows what he or she has been doing and offers strategies to reduce risks for that person.
What about information technology support? Do we need any other system supports? We also need to think about liability to make sure we are covered there. What happens if the person is suicidal? We'll need a good response plan in place, and we have to make sure we monitor results to look for signs of danger.
This particular resource that I looked at, and maybe others out there, actually runs on a server at the company that administers the program, and no software is installed on our system. We are not in charge of making it run. We'll need to make sure the company we choose has a good tech support team and find out how they support clients. We'd also need to know how fast they respond to problems. The other schools that use these programs could give us a good idea.
But I'm sure that counselors will have to provide some tech support to help students who need help accessing the program. We would also need to ensure that our clinical team is adequately trained and feels comfortable using the technology before we roll it out.
If we were to recommend this program to students who come into the clinic, we would have to know, For instance, if they have enough bandwidth in their dorm room or at home to run it and access the videos and interactive activities on the website. I would also want to check with the IT staff at some other colleges to see if they have the capacity for students to use the program over the college wireless network. Of course, if students access the program on their own time with their own computers or mobile devices off campus, these issues may not be as significant. Regardless, we'll have the clients sign an informed consent form detailing their understanding of the benefits and potential hazards involved in working with us online.
Does this program meet the capability requirements that the college recommends for student computer use? We should ensure that all students have access to the same service.
I think it would be important to see if they could access it via their mobile device, because most students have smartphones now. I think they can also access all of the program elements from a desktop or laptop.
So what happens? They answer a bunch of questions about their stress and they get recommendations? What happens if they answer yes to all the questions, and they are at very high risk for suicide? How does it work then, when there is no actual person with them?
Well, most programs don't assess specifically for suicide. It looks like most of them warn users who are experiencing acute stress or are having suicidal thoughts or behaviors to call an emergency number or hotline like the National Suicide Prevention Lifeline.
Is there a message or a warning that says, if you are experiencing extreme stress or other serious problems and you want to talk to a person live, here's what you should do?
What I really liked about this program is that when you subscribe, you can personalize the resources page to list the local resources in the community, at the community college, and at the health center. If someone is in crisis, they can call the emergency number here at the center. There's another issue here that I don't want to overlook. Some kids from the college struggle with significant mental health and addiction crises. They're disabled with anxiety, have thought disorders, are depressed, or are drug dependent and scared to seek help. If this program can facilitate their entry into care, then we've provided a great service, and by intervening early, we may help them stabilize and begin recovery rather than getting worse before seeking treatment.
You're probably right. Maybe some evaluative research after the program starts can help us track stabilization. How about the issue of confidentiality? We could potentially be collecting a lot of data on a broad spectrum of students. How do these programs control for that?
In this particular program, data are stored on a secure server, not on an individual's computer or mobile phone. Each individual has a unique username and password they can use to access the program. There are algorithms behind the data so that individuals receive personalized feedback based on their response profile. There's also an administrative dashboard where administrators can see aggregate data as well as usage patterns. Some issues to consider in developing a web-based outreach and early intervention program. First, is the developer well known? Can the developer's references be checked? Does the developer have prior experience developing similar TAC programs? Is the program well supported by the developer? Next, are there empirical data to support that the program works? With which populations does it work? Are there published data? Does the program explicitly use evidence-based principles to guide behavior change? Next, are there a clear plan and resource list for users in significant distress or at high risk for self-harm? Next, is there assurance that all data entered into the system by participants are confidential and encrypted? Next, where will data be hosted, stored, backed up and maintained? Next, how will you obtain participant feedback about the program? How will you use that feedback in program development? Is the feedback aggregated or individual client data? Lastly, is there an administrative dashboard to monitor aggregate participant responses? Do these aggregate data reflect levels of impairment and actions taken by participants? Do the provided measures reflect the kinds of problems or questions participants have?
So we would want to put something on the site about all of the 24-hour resources, hotlines and that sort of thing, that people can use in a crisis. It sounds interesting. Seems like there are a few more steps to take, but I think it's something that we should pursue.
I agree. The program I'm thinking about tracking outcomes, we'd know how many students use it. We could ask students to evaluate it to see whether it's helping and what the limitations are. Maybe before we subscribe to the program, we could ask some students to get involved. That would take some of the burden off of us and help us test it to figure out what the best options are and whether they really.
After the meeting with Nancy, John researches the questions his administrator raised. He develops a plan that the university and the mental health center accept.